Well, hi everyone. Thank you for this invitation to present today the JAPreventNCD, which is another project to tackle the inequalities and also in the cancer beating and NCDs tackling area. I'm Sofia Terzi. I'm the EU Programs Project Officer from IDICA. And JAPreventNCD is a joint action about cancer and other NCDs prevention and action on health and their determinants. So some background information to understand why this is important, why JAPrevent and the prevention of NCDs is important. Non-communicable diseases account for the 87% of the total disease burden across EU member states. So if we can strengthen health promotion and have preventive measures, we could lower the prevalence of NCDs by up to 70%. Additionally, the UN Sustainable Development Goals aim to reduce the premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and the promotion of mental health and well-being. That's why European Commission, through all these programs for EU for Health and these joint actions, actively supports the EU member states in their efforts to reduce the NCD burden and achieve the UN SDG targets. So the aims, what's important, and the objectives for this joint action. The aim is to reduce the burden of cancer and other NCDs, and also the common risk factors, but at multiple levels. So both at personal and also societal level, and support the member states to take an holistic and also coordinated approach to prevention. So we have to improve, first of all, the joint capacities, to improve data and monitoring systems. We have to contribute to reduce social inequalities, a word that you are hearing constantly in this track, and also to engage with and support the key actors, including the decision makers at all levels of government, but also the civil society organizations, professionals, and the general population. JAPreventNCD has 48 months to run. We are the first year, so we started at January 2024, and we will continue until December 2027. The number of beneficiaries are 25, and a total budget of 95 million euros will be contributed for this action, and the European Commission's contribution reaches 76.5 million. The main beneficiaries are public health authorities, such as Directorates of Health and Ministries, public health institutes and universities as well. In addition, more than 75 affiliated entities and associated partners are participating in this project. The work packages are 10 in total. We have the 4 which are mostly common in all EU programs and projects: the coordination and dissemination, the evaluation and the sustainability. But we also have 6 thematic work packages. These are the regulation and taxation, the healthy living environment, the social inequalities, the monitoring work package, health in all policies, and also the identification of individuals at risk. I won't stand in this slide because we will see the work packages in the next ones. Work packages that IDICA participates in are work package 8, monitoring, and also 10, the identification of individuals at risk. So how do we plan to accomplish what this promising project wants to accomplish? We have work package 5 about regulation and taxation, which want to enhance the compliance, coherence, implementation, and endorsement of fiscal and regulatory measurements targeting key risk factors for non-communicable diseases. Objectives are the policy and legislation analysis, health and taxes, and also consumer food environment. Food reformulation is important here, and standards, and product labeling impact, so how can labeling influence healthier consumer choices, the marketing regulation, and also environmental and chemical safety, as well as policy monitoring and evaluation. It is important to understand that all these projects must have impact to the citizens, to the member states, to Europe as a union. So we have to find the correct indicators in order to track and assess the NCD and cancer prevention policies. Work Package 6 is about healthy living environments. So in this project, we will design, implement, but also assess the interventions that take an integrated approach to tackle the key factors driving cancer and other non-communicable diseases. We will emphasize to a community-driven perspective, and that's important, the intervention to prioritize co-creation and active collaboration with the stakeholders. Some specific objectives for Work Package 6 is to develop a framework that's very important for improving the governance in the integrated local interventions on healthy living environments. After that, we want to have some standards to assess the state of the art in each local context, to map the stakeholders, but also the community associations to be engaged in each pilot that we will run. Additionally, we want to assure that equity perspective will be included. We will also develop a health promotion framework for healthy living, and that's very important as well, that will exploit the best strategies and policies available to promote environments that will be free of unhealthy products, to increase the availability and facilities for supporting health behaviors, to develop and support healthy urban planning, green, clean, child-friendly, and age-friendly as well, city environments, and also invest on health literacy to support the community environment, the social cohesion, the resilience, and the promotion of social inclusion and community-based initiatives. Then to strengthen the disease prevention programs and also to develop indicators to monitor these implementation processes. Work Package 5 is about social inequalities. So we have here to aim through this joint action to reduce these inequalities related to cancer and NCDs across Europe. The goals are to gather the scientific evidence that is out there already on avoidable inequalities in cancer, NCDs, and their associated risk factors throughout Europe. To analyze these existing actions and policies that are already there, and then design and implement the pilot actions to target the mechanisms that contribute to health inequalities. We want to provide tools and methodological support to ensure the thematic work packages, which are presented today, to apply the equity-focused approaches, and also enhance health literacy and empower individuals and organizations. Work Package 8 is about monitoring all these actions. So many actions, many objectives, but how can we monitor what is happening? The goal of Work Package 8 is to improve the monitoring systems for the cancer and other NCDs across various levels. One level is European, next is national, regional, and local. These enhanced systems and improved systems will be able to support healthcare inequalities aligned with the goals of European Beating Cancer Plan. So this plan emphasizes the establishment of a European cancer information system and includes the development of a robust monitoring system as its key initiative. We will focus on monitoring key aspects such as health determinants, risk factors, healthcare access, and costs. It will also cover the entire process. We will start from the data collection stage and go up to the advanced methods to visualize this data and the modeling to predict future scenarios. There are 4 tasks in Work Package 8 for the monitoring. I will not go very deep in the details that we have here, but I will mention each one of them. The first task is the research and overview to provide a baseline by identifying the risk factors, data sources, and potential implementation. The second is the individual and clinical level. So we have here the assess tools and methods for monitoring at the clinical and individual level. We have the methodology, the population-based system to exploit population-based monitoring for policy decision-making. And next, we have the access and costs. This is also an important aspect for this project because it also adds burdens and inequalities. Next, we have a gap analysis and recommendation, and task 5 will have to combine all these findings from the other tasks in order to find the gaps, analyze them, and then provide recommendations. The next work package is work package 9. Its primary goal is to enhance the implementation of the health in all policies across various levels of governance, with a particular focus on addressing key risk factors and determinants to prevent cancer and NCDs. This involves to deepen our understanding, first of all, for the current systems, for the current processes, and the current tools that are used in health in all policies, to identify all the opportunities, but also the challenges associated with the implemented health in all policies, to evaluate the current state of monitoring and assessing policy implementations, and finally, be able to provide recommendations to strengthen the health in all policies implementation and to foster the discussion at both national but also at the European level. The last work package is about identifying individuals at risk. So this work package aims to reduce the burden of cancer and NCDs, focusing primarily on the individual level. We want to achieve that by providing guidance and generating additional evidence on how to integrate the information. We have information, but it must be integrated from generic determinants, demographic factors, and individual behavioral characteristics. Our efforts will include addressing key risk factors such as tobacco use, promoting healthy lifestyles, encouraging physical activity, and considering the impact of genetic determinants in shaping the preventive actions. I will not go through each of the tasks, but I will just mention them here so you can have a quick glance at them. It's, first of all, the state of play, the ethical, legal, and social implication, the lessons learned from COVID-19, and the implementation of personalized risk satisfaction. So as we reach now the end of presenting the work packages, we understand that there are multi-layers in preventing and tackling the NCDs and cancer. So we encourage all of you to share your insights, to engage with the project so we can achieve a healthier and more equitable future in health. Thank you very much for your attention.